Thank you again to Dr. Jarali and Prof. Mukri for the brilliant presentation. Now it is my pleasure to introduce Dr. Aida Bustam. Dr. Aida is a senior lecturer in emergency medicine with areas of research interest including medical education and the application of technology in emergency medicine. Furthermore, she has just recently returned from performing Hajj in Mecca. Without further delay, I would like to invite Dr. Aida to present a topic related to her recently conducted research on night shift related fatigue that is pertinent to all healthcare workers. Dr. Aida?
Assalamualaikum, very good morning. Thank you very much, Dr. Muhaimin. And thank you to the organizers and to all the participants who are joining to listen in this morning. Okay, so you can see my topic is about night shift related fatigue among doctors. And particularly what I want to present is about awareness and the applicability of guideline-based coping strategies. So why have I chosen this topic? I think it's a very important topic among us clinicians as well as other healthcare workers, because it is working night shift is an essential part of our day-to-day patient care, and it's something that we cannot avoid, especially for the young doctors. And if we do not know or be aware about the consequences of working night shifts, then we may not be able to cope with it. And you can see, like in the photo, like these doctors are looking very dashing, looking very glamorous. But I think behind the scene, it's just probably they are able to cope with the night shift fatigue. So there are very limited literature or research done, particularly in investigating the level of awareness and understanding among doctors. There are probably some studies among the other healthcare professions, but I think it's very, very scarce, particularly among medical students. And this is very important to highlight because medical students are our future generation, and they will be our future workforce and becoming junior doctors who will be working a lot in shifts, including night shifts. So I think this talk will help to highlight the importance of this issue. So there are many impacts of night shifts. Unfortunately, a lot of them are quite negative. Right here, I'm not trying to scare everyone, but I think it's the facts that we need to realize, and so that we can learn how to cope with this. So some of the impacts involve physical well-being and health issues, because of course working night shift disrupts our circadian rhythm because our body is programmed to sleep at night. But when working, we need to force ourselves to be awake and alert. So we are fighting our circadian rhythm. And therefore, some of the previous studies have published that nighttime workers develop long-term effects of this, including developing medical illnesses such as diabetes, obesity, and a lot of other cardiovascular diseases. Some of nighttime workers develop chronic fatigue as a result of chronic night shifts. And some even develop decreased immunity. The acute effects that we usually see because of sleep disruption, and therefore a lot of our nighttime workers, we feel very fatigued and it will of course impair our cognition. And you probably read in the news, junior doctors or healthcare professions are involved in road traffic accidents as they're driving home after post-night. It also affects mental well-being. Some of our junior doctors might develop burnout and a lot of other psychological effects. It might reduce their work satisfaction and decrease their empathy towards the patient while they're working because they're very tired. And there's evidence from previous studies to show that sleep-deprived doctors tend to do a lot more medical errors during work compared to when they have enough sleep. And interestingly, if you go off without sleep for 20-25 hours, your psychomotor performance can be at the level of someone with blood alcohol concentration of 0.1%. And if I calculate this according to Malaysian law, this is probably double the maximum level for legal driving. There are recommendations and guidelines And if you search through the internet, you might find some tips on how to survive a night shift. I chose this Royal College of Physicians because it's quite a comprehensive guideline published, probably the only one that is quite comprehensive. And this guideline divided the coping strategies into 3 sections, which are preparing for the night shift, surviving the night shift, and recovering from the night shift. So for preparing for the night shift, the recommendations that they've made is building a successful sleep routine, and particularly getting extra sleep before you start the first night shift. Now, all these recommendations in the guidelines may seem very obvious, but some are very useful. Even and some people are not even aware that the guidelines. So in particular about sleep is getting enough sleep before starting the shift, and particularly they recommend taking a 2-hour afternoon sleep before coming on duty. So they particularly suggest 2-hour afternoon in the afternoon rather than in the late evening just before you go on duty, because usually most people are at their highest alertness during the early evening. So it'll be more difficult to try and take a nap just before the shift. So it's easier to try and sleep in the afternoon. There's some recommendations with regards to diet, and they recommend high protein, low carbohydrate meal prior to night shift to maintain alertness during the shift. So for surviving the night shift, the guideline recommends taking 20 to 45 minutes nap during working time. And this may be quite difficult for emergency department doctors because they're always busy and always receive patients throughout the night. But it may be possible for the doctors on call with other specialties. So they're suggesting 20 to 45 minutes nap. It's not sleep. It's not like 1 or 2, 3 hours of sleep, but it's nap. And this is because of what we call the sleep inertia. So we tend to go into a deep sleep after 45 minutes. So if you're suddenly called and woken up during your deep sleep, so you fall into this sleep inertia, so it'll be more difficult for you to wake up. You feel groggy and you feel sleepier. So it's better to take these short naps and you wake up before you go into the deep sleep. Another strategy or recommendation is to make sure that the work environment is bright so that you are able to focus and maintain your alertness. And they suggest not to miss proper meals while working at night. In fact, they suggest whatever you eat during the day, you try to eat during the night time. For example, if you have lunch during afternoon hours, and so you convert that into your night shift, so you will have sort of a lunch in the middle, halfway throughout your night shift. Regarding caffeine, because some people do rely on caffeine a lot to stay alert. However, be cautious, because if you take coffee towards the end of your night shift, then you may not be able to sleep in your post-night and you will become more tired. Okay, so the recommendation also covers about recovering from the night shift, and this is particularly important because when you either want to recover for your second night shift and subsequent night shift, or you've ended all your night shifts and you need to return to your normal sleep-wake pattern. So the recommendations include, for example, being safe if you're planning a long drive, so consider the risk. Because what happens when you're fatigued, when you're sleep deprived, it impairs your cognition such that you're not aware that you have cognitive impairment. So you're not realizing you're feeling too fatigued to drive, and then you go on driving. So there's an article in newspaper that 1 in 4 junior doctors, they fall asleep at the wheel, while driving. Okay, another recommendation is to develop a routine for sleeping during daytime. So when we go on night shift, what we're having is sleep debt. So you need to pay back that sleep debt, and how we pay back is during the daytime. So, and it's not easy to fall asleep during the daytime. So it's important to develop a good relationship with our bedroom and our beds to make sure that the environment in our bedroom is conducive to fall asleep. For example, having a very comfortable pillow, making sure that the bedroom is dark, draw the curtains, avoid caffeinated drinks, and making sure the room temperature is very, very nice to sleep. And when on getting home, they recommend to try and sleep immediately, because if you arrive home and you delay by doing other activities, it will be more difficult to try and sleep after that. Okay, so that Royal College of Physicians guideline was published in 2006. Despite that, there is a study by Jackson and Morrison, 2013. Despite having guidelines, they found that junior doctors still found night shifts to be tiring. And this was because they couldn't implement the evidence-based guidelines. And there are many factors, one of it being a lack of awareness of all these recommendations and with all the strategies to cope with night shift fatigue. And the other factors would be like heavy workload, so they're not able to, for example, take a nap, and there's also lack of resting facilities in the workplace setting. So what we had, and Dr. Mira Chandrasekhar was my postgraduate trainee. She's now graduated, and for her postgraduate thesis project, she conducted study that explored on the applicability and effectiveness of guideline-based coping strategies, because as you can see in this 2013 study, even though guidelines exist, but junior doctors still finding it difficult to cope with night shift fatigue. So the previous study was a cross-sectional study, and Dr. Mira undertook a different type of study design. It was a qualitative study, try and answer these research questions. So what are the experience of emergency doctors in the applicability and effectiveness of guideline-based coping strategies to overcome night shift-related fatigue? And she also explored whether our emergency doctors had any other novel coping strategies not stated or not displayed in the guidelines. So this study was undertaken in the last 2 years, completed last year. It was a phenomenological qualitative research design. What that means is it's a research designed to explore, particularly very good in exploring experiences. So here we wanted to explore the experiences of our emergency doctors in coping with night shift fatigue. So Dr. Mira conducted semi-structured interviews and focused group discussion, and then we analyzed the transcript. We did a directed content analysis to code them, and then developed a conceptual framework for an iterative process. So I'd like to share you the results of the study. The study involved interviewing 19 emergency department doctors. Most of them were postgraduate trainees, studying for masters in emergency medicine, and a couple of them were service medical officers. So about 8 of them were male, and their age mean was 33 years old. And the median number of children that they had, because they are looking at whether they had any barriers in trying to cope with the night shift strategies. So number of children median was 1. And our participants had work experience in emergency department, meaning that they've worked in shift work system during night shift for 5 to 7 years. In UMMC, the frequency of night shifts per month was about 6, a range of 3 to 8 per month. Interestingly, despite guidelines being published in 2006 and various other guidelines or recommendations available, only one participant was aware of some form of recommendation for coping with night shift fatigue, although they were unsure if they were actually guidelines. So let's look at the results of the interviews and focus group discussion. And Dr. Mira divided into, according to the guideline strategies, pre-night shift, and what were their strategies for surviving during the night shift and strategies post-night shift. So here I summarize some of the contents of the interviews. So for example, regarding meals, referring back to the guidelines, I mentioned that they recommended having good meals. So almost all our participants took proper meals, and usually around 6 to 8 p.m. And mainly to avoid hunger during night shift. And one of them felt that they had to have that proper meal before going to work because usually there will be insufficient time to eat during the shift. Two participants regarded meals before coming on duty were important because they preferred not to eat during the shift. Okay. Regarding napping, 17 out of 19 participants thought napping before the night shift was essential. And most of them were able to take 2 hours nap, and it worked for them. But the timing of nap was variable. Some preferred napping after 5, some preferred to nap in the afternoon, so early in the afternoon. Regarding coffee drinking, not all of them are coffee drinkers. 10 of them like to drink coffees. A few of them could prefer to consume before going to work, while the others prefer to drink before and during the shift. And actually, it's not easy to try and implement these strategies because a lot of our postgraduate trainees, they have families, they have children, they have other dependents, and they have classes to go, they have meetings to attend. So only 4 participants cited no barriers which prevented them from carrying out their pre-night shift strategies, while others cited meetings and classes and so on. So what about strategies during the night shift? So let's have a look at what our postgraduates and MOs do to try and cope during the night shift. So they commented that, majority of them commented that they felt fatigue in the second half of the night shift. So after 3 a.m. Actually, this coincides with our circadian rhythm. Circadian happens around 3 to 6 a.m., where at around this time, our cognitive ability is at the lowest. So being aware of this is important because when we attend patients, we need to be alert. We need to have good judgment, clinical judgment and decision making. So we need to be aware when is the time during the night shift that will be the least cognitively competent. So during the night shift, 13 participants said that they preferred to take the nap if possible. So not all the time that they were able to take a nap because it depends on how busy the shift was. If they were able to take short naps, it would help them to feel more alert and freshen after they wake up. The duration that they were able to take was between 10 to 30 minutes. The rest, 6 participants, did not practice napping. And the most common comment by those who did not practice napping was that they preferred to have longer sleep, about 1 to 2 hours. So going back to the guidelines, I mentioned that you try to avoid taking long sleep because you want to avoid being trapped in sleep inertia. So if you go beyond 40, 45 minutes of nap, you tend to go into a deep sleep. And if you're woken up during the deep sleep, it will really disrupt your conscious level. You'll find it more difficult to wake up and maintain alertness. Okay, regarding the working environment, bright lights, the majority of them preferred bright lights to help them to stay alert and to help them perform better and reducing the chance of making mistakes. So we are able to switch off certain lights in our emergency department if we wish to do so, but keeping a bright light would help the workers. Patients might prefer dark rooms though. Okay, so the other factor of strategies not mentioned in the guidelines, but discovered during our interviews, is that our trainees said that a busy shift actually was an external factor that kept them alert and maintaining their performance. So being busy can actually be very good. So a lot of other things that we discovered and how our participants cope with keeping alert during night shift. So some of them, like they said, they're having conversation with colleagues, having active discussion among colleagues and maintaining a cheerful atmosphere, having good teamwork. So they support each other and that will help to reduce the work burden and tiredness. Some of them walk and visit their friends in other zones to keep them active. Some of them snack during night shift and keep themselves hydrated. Few of them watch Netflix if they could and listen to music. And one of them mentioned about going out every so often to wash their face to keep alert. Okay, so what about their strategies put in the post-night shift? So all of them preferred to go and rest immediately if they could, which is quite good, which is consistent with the guideline. However, the duration of sleep was variable between 2 to 8 hours. I think 2 hours is a bit too few in order to recover. Majority of them fortunately reported having comfortable environments to sleep and rest. However, if there were classes or meetings, they would forego the sleep and attend the classes first. Okay, so we also asked them whether they took any special measures in order to be able to return to the normal sleep-wake cycle. A majority of them did not take special measures, and what we discovered was these are participants who've worked in the emergency department for the past 6-7 years, so they're very, very used to working night shifts. So, and therefore, they felt that they did not have to take any special measures. One participant, though, had to take antihistamine to induce nighttime sleep to readjust. One participant reported struggle to readapt. It would take them up to a week, but they did not take any special measures to overcome that. So, in conclusion, actually, although almost all of our participants were not aware of existing guidelines and coping strategies, but what they actually practiced was somewhat consistent with the guidelines. It's noteworthy to say here that the Royal College of Physicians guidelines are mainly guidelines. Then they did not describe how they come up with the guidelines. Some of it would be evidence-based, but not many, like, like how much time to sleep and when to wake up and so on. So I'm not sure how they developed that, but I think the findings from this qualitative study by Dr. Mira, I think it somewhat helped us to understand more, and actually some of the strategies and some of the recommended guidelines actually work for our doctors. So actually there were other questions that we asked our participants. For example, we asked them suggestions how to improve. So in Malaysia, we have limitations with regard to probably funding. So in some places, we're not able to provide on-call rooms. And also in emergency department, it's different because we need to be on the floor all the time because we have patients coming all the time. However, I would like to highlight that because the lack of literature, lack of training, especially among medical students, I think we are not preparing them. We prepare them a lot in terms of other skills, physical skills, but I think we should prepare them this life skill to survive night shift. So probably we can conduct workshops for our medical students. And this is my last slide. I'd just like to share some quotes. On the left and the middle, actually from the aviation industry experts. And they said that fatigue is a state of mind and that the effects of self-induced sleep deprivation could be overcome by professionalism, training, or motivation. But some of them thought that people actually cannot adapt to insufficient sleep despite their beliefs to the contrary. There's a study in 2016 among clinical residents, and they found that residents tend to believe that fatigue is surmountable, we can overcome it, rather than seeing fatigue as hazardous, and that learning how to overcome fatigue is part of becoming a competent physician. So for that, thank you very much, and I'll open the floor for questions.
Thank you for sharing the results of your research, Dr. Aida. We have several questions from the participants. Number one is, I noticed that the study is conducted in the emergency department. Can you comment on the generalizability of the findings and how can we apply the findings to other healthcare workers, for example, in less acute departments or non-doctors?
Yeah, we concentrated on the population of emergency department doctors because I guess we are the ones who are, I mean, night shift is like, you know, our business, in our work. it's not, I don't think we can generalize it to the other specialty because they may have a different work system. They are on call, although I have to admit a lot of our like surgical and other medical colleagues, when they're on call, they're always on their feet. So I guess they could also take some messages from this and learn some of the strategies.
Wonderful. The second question is, can wearable technology and digital interventions be employed to monitor and manage fatigue levels in healthcare professionals working night shifts?
Yeah, that is a very, very good question. I think with the emerging technology now, I mean, there's been some articles suggesting we could develop wearables to detect when we are fatigued. Although I'm not very familiar or not expert in what kind of technology is that. Yeah, maybe they can detect hormone levels or our vital signs, maybe.
Yeah, I think there is an avenue for more research in using wearable technology, especially in fatigue amongst healthcare workers, especially because like wearable technology nowadays, it can detect the quality of your sleep, the number of hours that you sleep, especially your heart rate, like in the 24 hours that you're wearing, for example, a smartwatch. So it is definitely an avenue for future research. Okay, for the next question, I think we have several more minutes. How does the level of support and resources provided by healthcare institutions impact the well-being and fatigue management of night shift workers?
Yeah, this is another very good question. We did explore that in Dr. Mira's study, although I did not share it here because a lot of information. And it depends on where they're working, and some of the participants actually make comparison to their previous workplace. So there are a lot of constructive comments. For example, they wish that they could have appropriate facilities where they can have a nap, or a vending machine for snacks, for example. They felt that it would very much help them. And actually, we do realize that it is quite challenging to provide these facilities because we are very much limited in terms of hospital funding. But certainly, it's having awareness of this. I hope that the higher levels could see the need of our medical officers and how this actually would help, especially our medical officers are working for years and years in shift work, and we now understand that the long-term health issues and also psychological issues of this. So we should actually be thinking about providing these facilities for them.
And then I think like resources such as furniture in order to facilitate our doctors to take short naps at night, or the availability of, for example, free flow caffeine or high quality nutrition, I think would help in reducing fatigue among healthcare workers, especially in the
Or
emergency.
massage chairs.
Yeah, I think that's a very good idea. Anyhow, I think that's all the questions that we have this morning. Again, I would like to thank you, Dr. Aida, and everyone who presented this morning for the brilliant sharing session in today's UMHealth. Thank you very much.
Thank you very much, everyone.
Goodbye,
Bye.
and have a good day.